Hi guys, just wanted to give you a quick update. I'm getting tired and I'm getting sore, so I'm tired and sore, and I'll probably end up falling asleep to this movie, which I love, the movie Greenland, about a comet coming for Earth. It's good. Anyway, so I talked to the doctor about the blood work, the team that deals with the blood work, how you're feeling that way. He said he wasn't worried about it. He said your blood work was perfect. It looked just like it should when you come out of surgery. As far as like my hemocrit, he said you were like 3 full units away from even being, considered for a blood transfusion or something. So, and then my sodium was normal. So, as far as the dehydration, he just said if your pee looks like it's good, which my nurse said it did, and you're thirsty, just keep drinking. So I did switch to like Gatorade though. So I'm so tired. Anyway, and keep eating. So goal now is to poop. So obviously that's my goal too. But I felt it was so weird when I got back here. I was so silly and witty with the ladies in recovery, which is so weird. I don't know why. And I was like, I just want to get up and walk around. And so when I got back to my room, same thing. I like didn't want to lay down. I just wanted to walk around the room or something. They're like, you can't do that because I have like this many things hooked up to me. I have like 2 drains. I have the pain pump, which is dilaudid, and then I have an IV for fluids, and I have something else. So I have my oxygen, which my oxygen is like horrible when I'm not attached to it. It's like 80, and my blood pressure's been really low, like I don't know, like 85/40. Sometimes it's like 80 or 90/60. That's pretty common. Anyway, so that's the fun part. But a cool thing that I noticed is like when I breathe, which this could be a really good thing. I don't know what to read into. I'm not trying to read into it. I'm just excited now. But before, when I go to like take a deep breath or just to breathe, like after my surgery, last one, and even before I had surgery, like I could tell like I'm getting about this much use of my lungs. The surgery, it was like when I was laying in bed all like catatonic, it was like maybe I was getting like that much, and I just like I didn't want to take deep breaths because it hurt or I'd start to cough, and I was always coughing at home. But when I got here, I laid down and I was like, okay, I need to breathe. So I took a deep breath, and it goes to both lungs, whereas before I didn't feel that. And like this one always felt like it was less, which is where, my curve is more so, and where that wheezing was too. But like I feel it, and you're not supposed to really feel lung changes unless your curve is like 90 degrees or more. But anyway, I wanted to tell you about I can't use my tongue to wipe my teeth because I can't feel anything, so my tongue's probably going to be so sore when I wake up. Apparently the reason why that is they put two tampons in your mouth, literally, and then they send shocks from your head down to your feet to make sure that all your nerves are working. So they do the tampons to keep you from biting your mouth or biting your tongue. Sorry. So better your tampons than your tongue. But maybe I did bite it. Who knows? So we'll see when it comes unnumb. But I also have this numb leg, my whole left or right leg. He said that could be similar, but also where I'm laying on the table, there could have been compression that caused just the numbing of the leg. He said that it'll wake up. It's typically those are normal things that happen. So it didn't make me feel nervous at all, and I'm feeling good about that. But he said that it took a lot of time taking my hold on. It took a lot of time taking my rods out because apparently, I'm getting full. I need to I want to have a bowel movement, but I'm not having one. Apparently, my rods, there was just a lot of bone around them, but they weren't really secure for one. But he said the one rod had a crack. The other one actually did have a crack, but it was within the hardware. So there's a sheath of metal where the screw is, and it was cracked underneath that. So they were pretty jacked up. So he said when I get it back, I'll get a bag. And he said you'll probably have a lot of tiny pieces of rod. And then they took some pictures, so I'll get to see those. I'm excited. Then he said that everything went really well, though. They cleaned up the arthritic spots that I had, because there was some on top of the bone, of the area where they installed the new rod. And he said that, what else did he say? No problems otherwise. Everything looked typical, good. And they installed the screws in the hip or the sacrum, and then 2 other spots, and then at the very top. So again, he said there's some curve at the top, above the rods, but they didn't mess with that. And so hopefully we're good. So anyway, yeah. So he said it took a lot of pulling, or a lot of time to get that old rod out. So, but that's what they had back in the day. So that's what they had to work with. So, but he was really happy to see that I was moving around so much. So I think that was cool. Yeah, because I was right off the bed. I was you could just, I'm get off the bed. Oh,